Now, Manenberg doctors are bringing top-tier medical trainers into their gang-ridden neighbourhood to change the face of medicine. Now, they want to find out from community members how they can improve their healthcare services. This in collaboration with the Dean of UCT's Health Sciences faculty and other academics. Can this bold move change the medical curriculum based on ordinary citizens' input? Well, we've got Monique Mortlock who's going to be asking and hopefully getting a solid answer to that very question and further insight on this particular initiative. A very good morning to you, Monique, and maybe just break down what exactly it is this initiative is trying to achieve.
So essentially what the University of Cape Town is trying to do, or the University of Cape Town's Health Sciences faculty is trying to do, is to go to different communities, hear from residents themselves what they would like to see change in the training of doctors, in the training of medical professionals and your allied health professionals, like occupational health therapists. And we're starting here where the Dean and some academics from the Health Sciences faculty, they've actually surprised some of those UCT medical students here at the Shawco Clinic in Manenberg. And to tell us a bit more about this, I thought it would be great to start with a medical student. I have Buhle Mbaka, who is a fifth-year medical student at UCT. Buhle, just quickly tell us what happens here at Shawco Clinic. You mentioned that you guys rotate and go into different communities offering this free and very needed medical care.
Yeah, so Shawco provides primary health care for communities in Cape Town. This is particularly a PEDS clinic, and it's a multidisciplinary clinic with OT, with speech, with physio, with audiology. And we basically provide all of the primary care services with our medicine as well. Yeah.
And what do you think about this initiative by the Health Sciences faculty, actually hearing from residents what they would like to see differently when it comes to the training of doctors? Do you think it's a good idea? Do you think it's a necessary step?
I think it's a great idea because these are the people we want to provide the service for. So it's important for collaboration, so we know that what we give them is what they actually want. So I think it's a great initiative.
Thank you very much. That was Buhle Mbaka, for future Dr. Mbaka. And now to give us an idea of what's happening today, I'm speaking to a doctor who plays a vital role in getting initiatives like this happening here in Manenberg, Dr. Randall Otal, who's from Manenberg. Tell us what's going to be happening today and also where this idea, how this collaboration with UCT came about.
Thanks, Monique, and thanks for the opportunity. So, I'm affiliated to UCT. I just finished my master's in family medicine, so that's primary health care. And of course, yes, I'm from Manenberg, and this is my hometown, and I like to put back. So, Prof and Dr. Beg, the curriculum advisors at the Health Sciences faculty, reached out to me and said, look, we want to speak to communities because we would like to improve our teaching to our students, and what communities require from healthcare workers, and not necessarily what the university says students must do to the general public. So of course, coming from the Cape Flats, I'm familiar with what's happening on the Cape Flats, how people want to access health services, what the lingo is on the streets. So, and the university is in Cape Town, it's on the Cape Flats. So, why can't we import, some of the cultures and things that are happening on the Cape Flats, teach our doctors how it works here, and that so that they can better connect with our patients. Connecting with patients, I think, is key.
And in speaking to, what's going on in our government facilities, and what the people, I'm sure you've heard many concerns or complaints or so on. What do you think are some of the biggest concerns when it comes to from a community perspective?
Yeah, so from a community perspective, access to healthcare facilities still remains a problem, even though it's close. We're competing with things like gang violence, a poor transport system. How does a disabled person with a wheelchair get to a primary care facility with a taxi? They got to pay for 2 or 3 seats. And then they still have a reason why they're in the wheelchair. So, there are a lot of challenges, or what we call social determinants of health. And then obviously access, because I mean we've just got such a lot of people. I mean the hospitals are bursting at its seams. You see housing developments going up, but you don't see hospital developments going up that often. So yeah, I mean as a doctor still working in the space, it's tough. I mean, because you got to see the numbers, you got to see the patients, and then of course the lingo that I hear on the street is that people say, the doctor doesn't understand me, doesn't speak my language, I couldn't explain properly, I don't speak well in English, or you know there's certain terms for certain medications or conditions on the Cape Flats that use that lingo, and then that's why we teach our doctors not to use medical terms which we call jargon. You know, you got to come down to the patient's level, you got to listen, you know, those sort of things. So I'm quite passionate about that, because once you get you know, the proper story from the patient, you can obviously be a good facilitator and a good doctor, and you can provide sort of holistic care to the patient.
Thank you very much. That was Dr. Randall Otal giving us some insights into what's going to be happening today, how this collaboration with the University of Cape Town came about, and we will be tagging along with them as they go visit different parts of Manenberg, have those discussions with various members of the community, and listen to community members, what their concerns are, what their complaints are, and also speak to the Dean of UCT's Health Sciences faculty a little later on.
Thank you very much, Monique Mortlock, there bringing us those insights in Manenberg.